Hey everybody, we're back. All right, so I'm referring to our CPE skill requirements for the shoulder, and just double checking kind of like how we're doing. And the palpation was like super long. I think that's kind of the most important thing for me to help you with, because really the goniometry, I mean, I showed briefly. You know, you've got a really good book for that, and there are excellent, well, I don't know if they're excellent, but there's some references online if you want to use them. I figure at this point, you've got the hang of handling a goniometer, you've got the hang of feeling for end feels, so I'm pretty sure you'll be kind of okay. If we were doing this in lab, I'd probably back off a little bit at this point anyways, and just kind of be in the room and asking if you needed help. The flexibility tests, we already did those. I hope you found those interesting. Don't forget to use those for stretches. They're perfect for stretches. And earlier, I think might have made a mistake and said there weren't any measurements for limb length and girth and volume. I have never put those on the CPE, but I mean, I think they're kind of easy to figure out how you would do those. There goes our kitty Chip. Okay. So anyways, that's listed. There's 4 things there if you were going to have to measure those. We did the manual muscle test. We're done with that. A sensation, you're basically on your own to review it and learn the areas of the skin where these dermatomes and these peripheral nerves innervate. No DTR, and now we're up to special tests. And the last thing will be Therex, which we'll be taping tomorrow morning, and then I hope to post everything for you. So anyway, so special tests. The first one is the Apley scratch test. It's on page 36 in your book. This is the one that I already added this in the lessons before, but basically that was the one where you kind of tap here, and they have to tap to reach for it and see if it matches bilaterally, and then they do the ones behind the back and the one, you know, from above and behind the back, and so you're reaching for superior angle of the scapula and inferior angle of the scapula. We're looking for symmetry, and we're looking for just plain can't reach those points because we're too tight. So that's positive if they don't have the range on one side or the other. The next one, I'm going to go to page 24 just to remind myself where I am here. Okay, so Jurgensen's test is next, page 24. And this one is really hard to perform, and honestly, it's a pretty poor test, but it's such a well-known one that I think it could be fair game for the national board exam. So I'll put it on. I'm gonna demo it and expect you to find it to know it. This one is we're looking for pain in the bicipital groove. So one hand will be palpating for that groove. We're looking to wondering whether there's bicipital tendonitis. It would be the long head of the biceps in the groove, okay, if we do have the tendonitis. So we passively put the person in a position that we want them in to start. They're going to be pronated, and their elbow is going to be staying close to their body for the entire test, okay? So this one is kind of like a manual muscle test, one of those dynamic manual muscle tests, where you do the 3 rep test through the range. And that's one of the reasons it's kind of hard to carry out. So what I'm going to anticipate is this person is going to be going out and external rotation and supinating. So I'm going to resist that as he puts pressure into my thumb and against kind of my metacarpal head here is also giving some pressure. So he's going to push out like that, and I'm going to resist, and if we have pain here, it's a positive sign. Can you try to work with me here?
Yep.
Okay, so try to turn out and out that way. Great. Any pain here?
No.
Good, that's a negative sign. Okay, so that's a negative test for Jurgensen's. And again, like I said, the sensitivity and so forth is really not that great. So there's another test, much easier to perform and probably going to give you better results anyways. It's called the Speeds test, and it's on page 27 in your book. And this one is similar in that you've got to get your fingers at the right spot to see whether there's going to be any pain. But in this case, you're simply going to have their outstretched arm, palm up, and they're just going to do a motion like this, but you're going to resist them distally, okay? So I want you to push up toward your hand up toward the ceiling, keep it palm up while you do that, and I'm going to palpate here. I got a little click, I got to tell you, he clicks a little bit. I'm not sure why. But any pain in the groove?
No.
No, so that's a negative for speeds. Speeds, if it's positive for pain, again, could long head of the biceps in the groove, bicipital tendonitis. However, speeds tests can also sometimes pick up A glenoid labral tear. Okay, so that's another thing to consider. It's not always bicipital tendonitis. Sometimes you just have to, first of all, use maybe a couple of other tests. I didn't put all of those other tests on your list. I kept it kind of short this time, but you verify it with other special tests that really are specific for the glenoid labral tears, and see whether they, both give you the same result, that pain. It's also something to talk to the patient about exactly where they're feeling the sensation of pain, because, the tendon's pretty superficial, but sometimes they do have that sense of, it's deep, deep, deep in the joint, and they might even have that sense of a little bit of instability with it too. So you've got to talk to your patient as well. The next one is Ludington's sign. It's on page 29. This is the one where you put your hands behind your head like this. So clasp your fingers behind your head, and I'm going to have you step up just a little bit. And I would probably step on a stool if I was in clinic, but I'm going to be reaching for where I think his bicipital grooves are, and forgive me if I miss, but this is what you would be doing. You're asking the person to basically activate their biceps like they're going to be making a muscle, and their arms are in a pretty good position to get that long head activated, right? So it's the most shortened position. Okay, actually it's a position of active insufficiency even, correct, right? So pull as if you're going to tighten, and then I'm palpating, and do you have any pain?
Nope.
No. Okay, great. Okay, so that's a negative. That would, again, be another one for bicipital tendonitis. However, it might also be something that indicates where they have extreme weakness, or it actually maybe because they've ruptured, the biceps. And if that's the case, of course, they can't pull very hard at all on the one side. So that's Ludington's sign. Okay, next one is the drop arm, or the Codman's test. It's the one that follows.